Hi friends, good evening and welcome to my channel. Friends, daily we are seeing important points. Maybe these important points will be useful for your future exam. So today's important points we are seeing the autonomic nervous system, that is sympathetic and parasympathetic nervous system and its functions. So we will see what is autonomic nervous system. Autonomic nervous system is essential for survival and responsible for body's involuntary activities. So it controls the involuntary activities of the body and it is divided into two, that is sympathetic nervous system and parasympathetic nervous system. The function of sympathetic nervous system is it activates during the time of, that is during the time of body stress or body's fearful situation or in danger situation or during the time of physical activity. In all situation the sympathetic nervous system acts in the body, that is control the fight or flight response. And parasympathetic nervous system is just opposite of sympathetic nervous system, that is it relaxes the body after stress or after fearful situation or in danger, that is after that it relaxes the body, that is parasympathetic nervous system, that is control the rest or and digest the response, that is parasympathetic nervous system. So what are the functions? We can see the sympathetic nervous system and parasympathetic nervous system. First we will see the sympathetic nervous system. Sympathetic nervous system, it dilates the pupil, that is during the time of stress or in any danger or fearful situation. So dilate the pupil, we can think our body in a fearful situation how we will react, that is dilation of pupil of eye, dilation of bronchi and constriction of blood vessels, increase in the rate and force of contraction of the heart, that is heart rate will be increased, or decrease the secretions, glandular secretions like salivary gland, lacrimal gland and sweat secretion. Also decrease the gastrointestinal motility, that is intestinal function will decrease, and relax gallbladder and urinary bladder. We'll see parasympathetic nervous system function, it is just opposite, that is after fearful situation body comes normal, that is constrict pupil, constrict bronchi and dilation of blood vessels and decrease the heart rate and force of contraction and increase glandular secretions like saliva, lacrimal gland and sweat gland, and also increase the gastrointestinal motility, and the bladder function, urinary bladder and gallbladder function will contract, that is in sympathetic nervous system it will relax and parasympathetic nervous system it will contract the gallbladder and urinary bladder functions. So these are all the difference, that is sympathetic nervous system and parasympathetic nervous system's functions. So sympathetic nervous system activate during the time of stress, fear, and parasympathetic nervous system it will relax the body after stress or after that is fearful situation. Next one important area which is selected is Glasgow's Coma scale. This is one of the important section. The Glasgow's Coma scale is a method of assessing client neurological condition. So it is a method to assess the neurological condition of the patient. In this we can see the patient's motor response, verbal response and eye opening. First we are seeing the motor response of the patient, that is if the patient obeys a simple response means the score is 6 and localized painful stimuli means it is 5 and normal flexion or withdrawal means it is 4 or abnormal flexion, that is score is 3 and extension response the score is 2 and no motor response to pain, there is no response means the score is 1. And next we will see the verbal response of the patient. So if the patient is oriented, normally it is oriented means it is 5, score is 5, and confused conversation is 4 and inappropriate words, patient is giving inappropriate words means it is 3 and response with incomprehensive sound means it is 2 and no verbal response from the patient side means it is 1. This is the verbal response. And next is eye opening of the patient. So we will see the eye opening spontaneously if the patient is opening means it is 4 and in response to sound if it is opening means it is 3 and in response to pain it is 2 and no response, even painful stimuli. If the patient is not opening eye means it is 1. So in Glasgow Coma scale we are seeing the motor response, verbal response and eye opening. And in motor response maximum score is 6 and verbal response maximum score is 5 and eye opening the maximum score is 4. So the highest score is 15 and moderate means it is 8 to 12 and if the patient is on coma means the score is less than or lower than 8. Next one important area is Bishop scoring. Through the score, we can identify the mother is in progress of the labor or the mother is ready for labor or not. That we can identify. That is, Bishop score is used to determine maternal readiness for labor and evaluate cervical status and fetal position. So, what are the things we can assess in? What are the factors we are assessing in Bishop scoring is? So 5 factors are there. Maybe question can come from the area that the factors they will give, 4 factor they will give, in that 1 factor they will exclude and they will give the option. So we have to see what are the factors. First one, dilation of the cervix, dilation of the cervix in centimeter and effacement of the cervix, consistency of the cervix and position of the cervix and station of the presenting part. Mainly these are the main factors. 5 factors we are checking in the Bishop score. The score is like 0, 1, 2 and 3. If the dilation of the cervix is 0, there is no dilation means it is 0, and if it is 1 to 2 centimeter dilation means the score is 1, and if it is the dilation is 3 to 4 centimeter dilation means the score is 2, and above 5 centimeter means score is 3. Like that the score is assessing. Next, cervix, effacement of the cervix and consistency of the cervix, that is cervix is soft or firm, that we can assess firm, medium and soft, that is score 0, 1, 2. In this picture we can see, and position of the cervix, that is the head is in upper, that is in posterior position, if it came down, that is position of the cervix we can see, and station of the presenting part, everything we can see this in Bishop scoring. These are the main factors we are checking in the Bishop scoring. Okay, if the score is 6 or more indicate readiness for labor, that is the mother is ready to labor if the score is 6 or more, and if the score is less than 6 means we have to wait. Okay, what these are the main factors in Bishop scoring.